in every area of their lives, physically, mentally, spiritually, financially, and also be able to share our knowledge with each other. We are a community that supports one another. We share ideas and we gain knowledge from each other. If you want more information about what we do, you can visit my website, www.dreugeniacaternor.net. You can also follow us on social media, Facebook, Instagram, and you can also send me an email, dreugeniacaternor@gmail.com, or you can text or call at 443-623-6080, and we will get back to you within 24 to 48 hours. I would like to wish you all Happy New Year. And actually, we're in our second quarter of 2026, and I'm curious to see what we've done so far with all our New Year resolutions. Some upcoming events. So we have our Glow Empowerment Women's Seminar coming up in May 16th, 2026. That's going to be in Virginia. So if you have time, if you're a woman, if you want to learn more about different things pertaining to women, we have great speakers, including myself. We'll talk about mental health, we'll talk about physical health, we'll talk about entrepreneurship, we'll talk about parenting. So you cannot afford to miss it. If you're in the area and you can join us on May 16th, it's a Saturday, 2026, make sure you join us for that program. There's another program too that we have at the end of May in Dover, Delaware, is Perceiving a New Season. This is embracing change with faith and vision. It's for everyone. So if you're in the Delaware area or even anywhere in the DMV or Delmarva, just make it a point to join us. It's a 3-day program, Friday, Saturday, Sunday. So if you can join us, there are a lot of good hotels in the area that you can check into and be part of this wonderful, empowering program. So, today we have a special guest with us who is going to be sharing an interesting topic that most people have been asking about. Okay, and I do weight management, transformation center for weight loss, and we do have a lot of patients that have sleep issues. They come in, we try to help them, but nobody ever knows what happens when we sleep or even why we sleep. So we have an expert here who is, you know, long time or long term sleep specialist. So he knows a lot about sleep, what sleep does to you, why we need sleep, and what happens if we don't get enough sleep or why we don't get enough sleep, even though we think we are sleeping. And I will let him do his own introduction and tell us what he does and why he chose to do too much about sleep stuff. So, with no much ado, I will welcome our guest speaker, Dr. Bernard Addogoh, to take over the stage.
All right, thank you, Eugenia. Welcome everybody, and I hope to make this as more interactive as possible. Okay. So, Eugenia, I'm going to share my the whole Spotify video for. Let me say share, and let me do slideshow from current. Can you hear me?
We can hear you and we can see your screen.
Okay, good. Don't show this again. All right, so you can see this, right?
Yes.
All right. Okay, my name is Bernard, and I'm a dual board certified. So I deal with mental health and I do um, internal medicine stuff, but I've been doing sleep for, I just thought about it today. It's been 10 years since I started doing sleep. To be precise, what, March 16th of 2016, when I transitioned into sleep. Why did I start doing sleep? I don't know, but I felt like I just landed there because of my doctorate research program. And I have never looked back since because it is something that we think it is a normal thing. Oh, I'm tired, I'm going to go sleep. But sleep is not just anything. Sleep is something that we actually uh, need. So that is why I gave the topic, What Do We Sleep? Um, I'm wondering if we open up right now and we ask people to tell us why do we need to sleep, we're going to get interesting answers. But whenever you've heard this question come up, the simplest and the most common answer that runs through everybody is, oh, so we can get some rest. Right. What is rest? And sleep goes more beyond just getting rest because it is a lot of things that goes on when you go to sleep. So I'm going to cover couple topics, stages of sleep, what is a normal sleep, importance of sleep, and then I'll delve into a little bit of sleep disorders and treatment options. I won't dwell too much over it, and I'll let people ask their questions, and that way, if there's any type of treatment option, if somebody has, I can steer you in the right direction. Okay. All right. I always say one thing. My goal is for you to remember how you felt today because 90% of probably whatever I'm going to say today may not stick. But you're going to remember how I made you feel today, right? If I scared you, you're going to remember. If I just wasted your time, you're just going to remember that I just came and zoomed through stuff. So let's go. All right. I work for Delaware Sleep Disorders. That is why I've been doing sleep. And Delaware Sleep Disorders has like 5 locations across the state, from Wilmington all the way down to Georgetown. And I already mentioned I am a dual board certified. I also do have my own primary and mental health clinic located in Middletown and Newark. My research study was using a screening tool that is called StopBank uh, to educate primary care providers in Delaware to improve and diagnose sleep disordered breathing. And that is where I found and delved into what sleep disorders and what sleep was. Okay. So, what is sleep? So, first thing that comes up is if you see somebody laying down in the bed and their eyes closed, does it mean the person is sleeping? People who work night shift, when they're sitting on the job and the sleep comes and steal them, quote unquote, the word that they use. Some people, when they sit down, they say, oh, I wasn't sleeping, I was just resting my eyes. So what's the difference between resting your eyes and then actually sleeping when your eyes are closed? All right. Somebody once said that sleep is just a time machine to the morning. So night comes, you go to sleep, and then before you know it, there's morning. So it's just for you to while away the time, and then boom, go to the next phase of the day or your business. And that is definitely not true, because there are some people who work night shift. So what happens when they are working nights, but they have to sleep during the day? Mm. So not to bore you much, but this is what the definition of sleep is. All right. Sleep is natural. Okay, so I highlighted some things. So this means that whether you like it or not, if you decide to even take something to keep you awake for 4 days, either you go crazy, you start hallucinating, or your body is just going to crash. And when it crashes, you will go to sleep. So it is something that happens naturally. All right. When it happens, you have altered state of consciousness, meaning that once you fall asleep, you are not or may not be aware of what is going on around you. Around you. It is inhibited sensory activity. You're sleeping, somebody could be playing a drum. You may be gone. Um, I remember as I was in Ghana one day, somebody came sitting behind the window. Those windows were the ones that I can go through, and they were talking. And I went there and said, "Can you get up? I want to sleep." He said, "I'm not ready to sleep, because if I was ready to sleep, I could be in the concert hall and still fall asleep." Right? So if you are sleeping, it is inhibition of sensory activity, right? Reduce muscle activity. Nobody stands to fall asleep. You will fall. That is why when people are sleeping and they're driving, their hands may drop. When somebody is in a meeting and they are sleeping, their head will drop because muscles relax, right? And nearly all muscles or everything that can happens here are either nearly voluntary muscles with rapid eye movement. And I'm going to go into that with reduced interactions with your surroundings. So the next question is, if you don't sleep today and 10 years later, can you catch up or reverse your sleep? The answer is no. Is sleep something that is temporary? No, it is something that you need every day, and it's ongoing then. Is sleep restorative to the body? And the answer is 100% yes. Some people sometimes forget that the mind is part of the whole body. So the mind is in the brain there, right? And it's part of the body. So sleep is still restorative to the mind. And as important as sleep is also important for good exercise, nutrition.
We still can't take the IV.
And it's a vital necessity to maintain good health, if I should put it that way. You may exercise, you may eat right, but if you don't sleep, definitely it will be difficult to maintain that good health. Right. When we go to sleep, we go through different cycles of sleep. There are typically 4 cycles of sleep. Right. The most important one that when we go to sleep, we want to get is what they call the REM sleep, which is the rapid eye movement stage. This comes around after 80 to 110 minutes once you fall asleep. So if you're laying there and it's 2 hours, you're not sleeping, maybe you fall asleep and then your body will say, forget it, and it will just jump from stage 1, go to stage 2, and then boom, into REM sleep. But we have stage 1 sleep, stage 2 sleep, stage 3, and the 4th sleep mostly is the REM sleep. Okay. And So is sleep just something that you go and lay down and then you become inactive and wake up the next morning? You're going to find out the answer later on. And is this just a simple thing that you just lay there and then you try to sleep, which is closing your eyes, or just sleeping and actually sleeping? Is it an option that you can decide to sleep or not to sleep? All right. First, we all have to understand that depending on your age, there is a certain amount of hours that you need to get to actually allow your body to rejuvenate. So if you have a newborn, 0 to 2 months, that kid can sleep anywhere from 12 to 18 hours in a day. You feed them and they go back to sleep. They wake up, they get fed, they go back to sleep. And as they begin to grow, the hours that they need for sleeping begin to go down. So somewhere between 3 to 1 year, they need just about 12 to 15 hours, no longer 18 hours. Once they 1 year old to 3, they need 12 to 14 hours of sleep. 3 to 5 years, 11 to 13 hours of sleep. 5 to 12 years, 10 to 11 hours. 12 to 18, 8 to 10 hours. So if you have a child and they are growing, it is essential to know and understand that the child actually need a certain amount of hours to be able to perform and function and be productive and successful. If they're not getting this amount of sleep, it is going to impact productivity, and performance is definitely going to take a toll. Right? As an adult, you need at least minimum 6, but it is recommended 7 to 9 hours of sleep, somewhere there. And it's not just laying down, but actual sleep. After the age of 65, the same amount of sleep is required, but that sleep becomes fragmented. So instead of sleeping straight up like maybe 6 hours, maybe get up once. When somebody is older, they will sleep 2 hours, wake up, and then they go back to sleep. So their sleep is fragmented, but they're still going to have to need that 7 to 9 hours of sleep in a day to be productive. So what functions does sleep serve, though? So basically, the first thing is once you go to sleep for the body to recover from the day's hard work. Whatever you've done through the day, for your brain to process things, which we call filing away everyday data, you have to go to sleep and go into REM sleep for the body to file away that data. Okay. Organizing your memories. If you have poor sleep, your memory is going to be affected big time. Do you remember when I asked, is sleeping an inactive process or is it something simple? It is actually an active process, and it's actually a complex process that happens once you fall down to lay down to sleep, whichever position you lay. So that brings us back to the question, so why do we sleep? Is sleep that important to human beings? The human being is made up of all different parts, right? So we have our respiratory system, we have the body temperature, we have the gastrointestinal system, we have the neurological system, metabolism, muscular, endocrine, name it. Even your immune system and your mentation is your cognitive function. If you don't sleep, none of this part of the body is going to be spared. It is going to be affected. So sleep affects every part of the body, simply put. I can explain into detail which part, how, and all that stuff I wouldn't bore you, but as we get down and questions come, I can break them down into individual organs and how they are impacted, and why you may experience some symptoms that simply will require you getting your sleep in order, and that can resolve that issue. Okay. These are common diseases that we go to see our doctors for, or your PCP, whichever it is. High blood pressure constitutes mostly almost 95% of chronic care visits in primary care setting, according to the CDC statistics. All right. But poor sleep alone can increase your cardiovascular risk 35%, diabetes 25%, stroke 22%, obesity 21%, poor cognition, functioning, decreased pain tolerance, and depression alone. I mean, I can go into these statistics, but I don't want to bore you. However, look at these things here. How many people are on blood pressure medication? How many people have diabetes in America? Stroke. We talk about weight, and it's a big thing. Everybody now knows that if you have money, back in the days in Africa, gaining weight or looking fat means good living. Now we know that is not the order of the day anymore. It's actually a risk. So everybody is trying to lose weight. However, if you get on medication assisted weight loss and your sleep is not good, it becomes one, difficult to lose that weight, two, maintain that weight, and three, you probably will not be able to lose that weight completely. These are some stunning statistics about what poor sleep has caused in our world. And we all know this is something that we talk about. There was what they call 3 Mile Island nuclear accident. It cost $1 billion to clean that nuclear accident back in 1979. There was an Indian disaster back in 1984. 392 people perished their life. The Chernobyl nuclear accident, 4,000 people died. The Exxon oil spill in 89. These are major ones, right? Now, how does this affect us? All this happened because somebody wasn't sleeping and an accident occurred and innocent life were lost. Very cost expensive, cleanup because somebody did not sleep. Back in 2014, back right behind our back door, there was a Walmart driver who has sleep apnea and had not slept, used his CPAP, and just wanted to make sure he gets to his destination and make his money. Right on New Jersey Turnpike, had a major accident, collided with a very common comedian, Tracy Morgan. He escaped narrowly, but his driver was killed. It is believed that the biggest ship that somebody built and said, even God can't sink it, but it got sunk. Who knows? Titanic, right? The belief is that the captain fell asleep. That is why he did not see that ice until too close, and they just slammed into that ice. And we have a movie before, watched Titanic. There was an accident in New Jersey, a major big accident. About one died and a lot of injuries by the Amtrak track in Philadelphia. All because the train engineer has sleep apnea, wasn't sleeping, wasn't using his CPAP, and fell asleep whilst on the job. I mean, I can count number of accidents, right? However, 13% of work injuries that occur on the job is related to poor sleep. And 30% of accidents that happen is due to risks, some risks associated with sleep, especially for people who work night shifts. When you don't sleep and you're driving and drowsy, you are more a risk to everybody. You put everybody, I should say, you put everybody else at risk more than even a person who is legally drunk. Okay. According to research, 2 hours of lost sleep is like somebody who has drank 3 beers. So if you don't have good tolerance to alcohol, just imagine 1 beer and you're drinking 3 beers. If you stay up for 20 hours or more and you haven't slept, you are equally liable to somebody who is driving and his alcohol level is beyond acceptable limit, and that person can be charged for driving under the influence because you are legally drunk. That is how serious sleep is. Okay. However, 83.6 million people drive while sleep deprived every day on the street. So if you're on the road, go look up Delaware population and then look at how many people are on the road, and then you can make your own statistics about how many people on the road that you're driving with are probably sleep deprived. And if they are more than 20 hours of sleep deprived, you can consider them legally drunk and still driving. Driving, according to this is, I think, 2 years old, but there's a new, so I was looking for that data, couldn't find the newest data, but this is just for the United States alone. We're not even talking about Africa, but driving kills a lot more people on the road. Right. This brings us to where I start talking about sleep and type of sleep disorders, because we know we have to sleep. But sleep is not just saying I can sleep. There are different type of sleep disorders. Some people can fall asleep. They can stay asleep. Some people can fall asleep, stay asleep, but a whole lot of things goes on that actually impact their sleep. Okay. So first type of sleep disorder is I can't sleep, which is what we call the insomnias. Right? Either it is something idiopathic, meaning that they just can't sleep, or it is a behavior. You go to sleep. Nowadays, people go to sleep, they have their phone on, they have all the notifications, they are on the blue screen and they can't sleep, or just they cannot sleep because their mind is racing. Sleep-related breathing disorders. When you go lie down to sleep, 3 things has to happen for you to achieve the goal of sleep. Your muscles have to relax, your heart rate goes to what we call a resting heart rate, and your body temperature has to drop to a level where the body can actually go through those stages of metabolism for you to go to sleep, wake up feeling refreshed. If these 3 things don't occur, you can sleep but no wake up feeling refreshed. Yeah. And One of the most common ones is the sleep disordered breathing, where people go to sleep and they can breathe. They start with snoring, and then the next thing you hear them choking. Some people wake up, coughing, heartburns, and drink water, go back to sleep. I can explain all that later on. Hypersomnia, those ones are the ones that we loosely describe as having narcolepsy. The person can fall down to sleep, be able to fall asleep, but when they are sleeping, they wake up in the morning and their body still wants to go back to sleep. There are different type of narcolepsy. The ones that they will be walking around and feel like things is moving around them, or the ones that just sit in the car from one end, and the moment they sit in the boom, they fall asleep. I had a patient who was living in New York. Once he get in the train, the next moment he's being awoken at the last stop. Gets on the bus, then that's what happens. I mean, this can be very debilitating. So sleep is really serious. Circadian rhythm disorder. People who work shift work. You work day shift, you work night shift. It throws your body circadian rhythm off. So when you're off, you can't sleep. It is a natural disorder. Parasomnias. I was nearly pulled into a court to go testify for somebody who had parasomnia and actually raped somebody, and he had no idea what happened. It is a sleep disorder. Those are the extreme situations, but people go to sleep, wake up, get in their cars to go buy food, come eat. They have no recollection. I can tell you stories and stories about sleep disorders. All right. Uh, this parasomnia, some people sleepwalk. They will be screaming in their sleep. Their legs kick. They will grind their teeth. And you go see the dentist, they make you appliance, and you come back and just go about your business. But it is a sleep disorder that needs to be addressed when you have any of these symptoms. I'm going to skip some of this. All right. So what is the most common thing we hear in the clinic setting when people have sleep disorders? After they come and you address their blood pressure or the weight or anything, whatever it is, when you're about to leave the room, the question that you get is, Doc, I can't sleep. And now that is the most difficult part to actually peel out and see what is the problem. Is it difficulty falling asleep? Is it difficulty staying asleep? What else is there? But you spend your time with that patient and now you're walking out and he says you can't sleep. So the de facto thing we do is write the patient something to go sleep. And it may not work because there's difference between insomnia and I say sleep apnea, but it is called sleep disordered breathing. So if the patient just have difficulty falling asleep, that is insomnia. Have difficulty just initiating the sleep, but there are some people who can fall asleep and they have difficulty maintaining sleep. When do we hear these complaints? Do anybody record their partners? We get this on the phone a lot in the office when they come in. Oh, he recorded me. This is classic snoring, right? I just shared this slide. If you have sleep disordered breathing or any sleep disorders, this one says consequence of sleep apnea, but this is in a nutshell all the things that I'm talking about. This is what poor sleep can cause. So if you don't sleep, you put yourself at risk for any medical condition. And so we need to sleep. This is unnecessary. So how sleep impact our health? This will be much more simpler. So if you have untreated sleep disorder, this is more common to people who have sleep apnea or sleep disordered breathing. Whether you have sleep apnea, whether you have restless leg, any sleep disorder that you have is going to fragment your sleep. You will not have restful sleep. If you don't sleep, your immune system is going to be affected. What is your immune system? That is when you get sick, your body is able to recover without you being on medication. So if you have any sleep issue, it's going to affect your immune system. Then this pathway breaks into two. There's the part that goes to affect your heart. Most of the people that go and see their primary care doctor for high blood pressure, 77% of that is because they might have underlying sleep condition. Just think about that. That you're taking medication for high blood pressure or something, and it's actually because you have a sleep disorder. When you fix that sleep disorder, maybe that pressure may go away. And we have taken people off, especially blood pressure medication, because we fix their sleep or whatever it goes on. If you work with anybody, if they come to work and they have no sleep, people come to work agitated, they feel stressed, daytime fatigue. No, they don't feel like doing anything. This is where no physical activity, then weight compounds. You drinking the coffee, that is a lot of beverage, sugar, and then the weight comes on. People develop anxiety, depression, obesity, metabolic disease, on and on. On the right, the cardiac, they start with high blood pressure. People begin to have arrhythmia. And if you have any sleep disorder, especially this applies to people with stroke, with men, 3 out of, so I should put it this way. Men who have sleep apnea, if you take 100 of them, 3 of them may end up with a myocardial, a heart attack if it's not treated. Okay. So if you have any sleep disorder, just remember that your health, or if you're not sleeping and you don't sleep, your health is definitely going to take a toll. Sleep assessment and screening for sleep disorders is done by providers. When I say providers, meaning your doctor will be the right person if you're having difficulty or you have any sleep issue. You have to talk to your doctor so we can see what is the average amount of sleep that you need per night. What is the overall quality of sleep? These are things that questions that they're going to ask in so many different aspects to evaluate and tell if you're having trouble sleeping or you're not getting good sleep. Are you alert throughout the day? If you go to sleep, the goal is for you to wake up feeling refreshed. So if you're waking up and you can't stay alert, then there's an issue. And you yourself, how satisfied are you with your sleep? If you're not satisfied, then why and what is going on? Okay. If you haven't any of these symptoms, that was a red flag. That is a light bulb going off that you have some sleep disorder that you need to get addressed because you are sleeping, but you're not sleeping. Okay. I hope you understand what I mean by that. You're laying down to sleep, but you're not actually sleeping, if I can put it simple like that. If you have excessive daytime sleepiness, if you snore, a family member have told you you go to sleep and they witness you quit breathing. Excessive vivid dreams. You having to move whilst you're falling asleep or during sleep. Sudden muscle weakness triggered by emotion. You start laughing and then maybe your jaw locks. You lay down to fall asleep and then you can't move. Unusual behaviors during sleep, like talking, walking, eating, um, having sex that you don't even remember, things that during the night happens that you have no idea what, when, and how it happened. You need to talk to somebody. It may be the clue that you have some sleep issues. You're going to sleep, but you are not sleeping. Okay. There are different treatment therapies for sleep. The first thing when we start talking about insomnia is focus on sleep hygiene. What is sleep hygiene? Sleep hygiene pretty much involves your behavior. I mean, what you do before you sleep, during sleep. Are you sleeping in the right place? Are you sleeping in the bed or you have a habit of sleeping in the chair? If you sleep in the chair, why do you sleep in the chair? Right? Are you behind your phone and you're on the phone and falling asleep with the phone dropping? Do you have TV in your bedroom, the blue light? I mean, what do you do? What is your ritual before you go to sleep? Are you taking a shower to calm the body down? Are you sleeping in a quiet environment? Do you need a sound machine to quiet your brain down? Are you avoiding fluid close to your bedtime so when you go to sleep, your bladder will not wake you up? These are all things that needs to be addressed before somebody starts putting you on medication. Okay. Then cognitive behavior therapy for sleep. Sometimes you need to go talk to somebody and find out why you can't sleep. We don't just jump onto medication. There's a lot of medications for sleep, but if you are a patient and you are a provider, these are medications that people jump quickly to put patients on. Ambien. So many, there are different names. You see Zolpidem, you see Lunesta, different name. But as a patient, as a provider, what we have to remember is that your first line of treatment is this, but they are for short-term use and it's not intended for long-term. Can people be on this for long-term? Yes, but you have to explore your options and find out. Just you may have to meet the patient at their need. They can't sleep. You can't let them go. You need to treat them in the short term, but this is not meant to be initially the long-term solution for the patient. They're going to come back and tell you the 5 milligram is not working, the 6.5 extended is not working, the 10 is not working, and then the 12 is not working. If you are prescribing, you are going to hit a brick wall soon. If you are the patient, you're going to run out of options. They're going to take you off that and put you on something else. You need to find out what is the cause of why you're having trouble for not sleeping than jumping straight to the medication. Okay. And when we talk about changing medication, if you give you the one that is designed for sleep and it's not working, we put you on hypnotics, short-term use, because it can linger during the day and make that person tired. I've talked about movement disorders. So what are the things that you can do? I mentioned some of them: exercise, yoga, sometimes even lavender. The smell of it in rooms can relax you. White noise. If you sleep in a noisy area or your neighborhood is noisy, earplugs help. Some people need mask that covers their eyes. Like if you get in the airplane, you see people use this a lot. There are smart pillows that try to help contour your neck and body so you can sleep in a comfortable place. There are smart beds now. So if you're sleeping and if you're sleeping with your partner, you can adjust the the mattress to your specification so you can sleep. There are sheets that are actually made high-tech now that it helps your body to relax, cool your body temperature so you can go to sleep. And some sleep relaxing techniques are available also, right? So at this point, we've gone to work and we uncovered there's a devastating side effect of sleep deprivation. We don't know what other people think about your sleep, so I will end here and take questions. Thank you.
Hello.
Hi.
My question is about people that talk in their sleep. I don't know if you address that. Can you give us some more insight into that and why that happens? Thank you.
So, talking in your sleep is what we call parasomnias, right? There are multiple etiologies, there are multiple causes. It is one, maybe the person has a mental health disorder that once they go into REM sleep, they begin to talk, which is the deep stage of sleep. Two, what we find most common is their oxygen drops during deep sleep because their muscles relax, their airway begin to close, and they get into that confused state and they begin to talk because the brain is trying to get them out from sleep. So sleep talking is a sleep disorder is parasomnia, most often may be triggered by some form of one or two, one of those sleep disorders, and we need to delve into, get a sleep study and find out what is causing that. Is it behavior or is it coming from typical hypoxemia, which is desaturation of your oxygen level when you go to sleep?
Thank you.
You're welcome.
Yeah, Sister Soul, you can go ahead and ask your question.
So can a condition with your brain cause lack of sleep as well, like anything that pertains to like the pituitary?
Okay.
Like for instance, maybe a brain tumor or a raised cleft cyst in the pituitary, would that cause lack of sleep if there was pressure?
So if just to go straight, so the pituitary is in your brain, right? So on the other hand, if you have any tumor in your brain, that tumor will probably increase your intracranial pressure and should cause um, pretty much sedation. So that is when somebody maybe hit their head and they don't seek treatment, they may just bleed and increase the pressure in their brain, go to sleep, and eventually you see them very sleepy, and then eventually they might slip into coma unless they get intervention quickly. They may die from that. Now, can pituitary tumor cause um, difficulty falling asleep? In that blanket answer, I'll say no. All right. It will be the opposite. Can any adrenal condition like hyperthyroidism or hypothyroidism affect your sleep? Yes. If my long answer to that does that answer your question?
Yes, thank you so much.
Okay.
Anybody else have any other questions? Or you can also type your question if you don't want to speak in the chat. Okay, whilst we're waiting, well, Dr. Bernard, I mean, this is such good information about sleep. I mean, it's one of the things that we take for granted, but there's a lot more that goes into sleep than we can ever imagine. So thank you for the knowledge that you have shared with us. And personally, I have learned a lot from it. And one of the things that I tell people when they come to me, oh, I was taking what's it called? Some of this
Zolpidem.
No, like the over the counter.
Oh, Z-Coil,
Right, this was,
NyQuil, and all that stuff.
well, I mean, my take home on this presentation is don't just take medicine for sleep because you cannot sleep. Trying to find out what the cause is, because things don't just happen. There's always a reason behind what you're experiencing. I mean, it could be because you're just tired. It could be because you have other problems that is manifesting as lack of sleep or sleeping too much. So don't just diagnose yourself and take sleep medicine. If there's one thing that I'm learning from this is we cannot self-diagnose ourselves and assume it's okay. I'm hearing a lot of people go to sleep and don't wake up again. We don't know. Maybe it's because they have other issues and they went to take this medicine. We don't know what they're doing. All we know is we spoke with them last night. They went to sleep, they didn't wake up again. Who knows? They may have taken something that interfered with whatever condition, whatever is going on in their body or in their brain. So, very, very important. Be careful what you put in your body if you cannot sleep. Yes, Mrs. G, you can ask your question.
Okay, so what about for children? I know, you know, I have my girl take melatonin often. Is there like another alternative, I guess, for children? Because they're very hyperactive, and it's, you know, with the phones and everything too, it's just hard for them to go to sleep. Any advice?
Yes. So couple things that you said, they are hyperactive. Do you know that a lot of adults have been misdiagnosed with attention deficit disorder because they had childhood sleep disordered breathing, like sleep apnea? All right. So if a child is not able to sleep, the question is, what is going on? Is it behavior, or is it something psychogenic that is going in the brain that he's not able to fall asleep? A child may be hyper during the day. Is it too much energy? Is it chemical imbalance? Or do they have sleep disorders that they can sleep, and during the day, instead of channeling their energy into productive stuff, because they can't sit still, they know they're going to fall asleep, they become actually distracted by what we call hyper. Sit in class, go put, they become the people who are distracted in the class, and we get notification from the school. And the next thing, if you don't get somebody who will understand and see the patient as a global, like what is going on here, the head and the body, they're quick to put the child on medication for attention deficit disorder, change their chemistry forever. So is melatonin an option? Yes. But the question is, even the time you take the melatonin has to even coincide with when darkness is actually coming, because the body is supposed to secrete its own melatonin. So if a child is not able to sleep, I'm not saying melatonin is not good, but why is the child not sleeping? Because if you give excessive melatonin and the child is not able to metabolize it, the next morning they are even more tired than not even taking the melatonin. So don't just give the melatonin. If my answer is right, seek help. Let the pediatrician know that the child is not sleeping, and they're going to sit down and ask questions, do the appropriate referral. Sometimes you start with going to see a sleep therapy where they will explore sleep hygiene. The next moment will be going to see their ENT. The next one will be from the ENT, they send them to a sleep clinic to get a sleep study to rule out any sleep disorder. By the time you get to those, we probably have a good idea of why the child is not sleeping, because if you give them melatonin 1 milligram today, in 3 months or in 6 months, you're going to be giving them 5 milligrams of melatonin. So it is important to find the why they can't sleep before we resort to medication.
Okay, thank you so much.
And just to add to Eugenia, so most adults who die in their sleep, some of them don't even have, the ones that they go to sleep and don't wake up, they don't have trouble falling asleep. They have trouble staying asleep. And we find out that they have trouble for staying asleep because they have hypoxemia, the oxygen drops. So he takes something to help him sleep. The sleep becomes difficult. Difficult, becomes much more deep. And when the airway closes, the brain is not able to wake them up. So it's nothing different from somebody choking them. The oxygen drop, they can wake up, they get cardiac arrest in the middle of the night and just pass on. Some people, unfortunately, they may wake up with ischemic stroke. So the Z cord that you said, when I see people come and I tell them, is it this one you take? You say, yeah, you go in there. It either has different names, because if Walmart is making it, they're going to put a different label on it. Walgreens is going to put a different label on it. But most time it has some alcohol in there, or 90% of that, it has Benadryl in there. If you take in Benadryl, it has antihistamine, and research now shows one, not going to dry you up, but there is cognitive issues. People are developing dementia on top of everything else that is going on. The lack of sleep is going to affect your memory, and the Benadryl is beginning to find out long-term use of that diphenhydramine is causing dementia, increased risk for dementia.
Man, it's a lot. Sister So, did you have a question?
I did.
Okay.
So if a person who has very low blood pressure and whose glucose also drops, like a hypoglycemic as opposed to the hyperglycemic, but their blood pressure as well as their glucose drops very low, and they get very lack of sleep. Like you can go to I can go to sleep, but I don't sleep very well. I don't sleep for very many hours. Um, I'm right back up again. Is that considered like what Dr. Eugenia was saying? Sometimes I can get up like because I feel like I'm short of breath. Is that like is that something that should be desperately addressed? Like, is that something that I should be concerned about?
Yes, you mentioned one thing, short of breath.
Yeah.
You lay in the bed, you're not running, right? You're
Right.
not doing any exercise. So the simple question is, why do you become short of breath whilst you're laying in the bed? I zoomed through, but this is what happens. I said when you go to sleep, 3 things happen. So naturally, once you lay down to sleep and you don't have trouble falling asleep, guess what? Your brain tells your body, okay, time to shut down. So muscles relax. You breathe through the nose. Your airway is right in front of the tongue in your mouth, right? Which is part of the entire lower jaw. And then that air goes into the lungs, brings in the oxygen, and then you breathe out and take the CO2 that your body has generated out. The neck is a muscle. The airway you breathe through is a muscle. So some people snore louder, some people don't, depending on how big your airway or small your airway is. So you can go from right away falling asleep and snoring for a little bit. And if you don't have a bed partner elbowing you to roll over, you yourself may wake up and then you feel short of breath. Simply what happened was you just quit breathing, your oxygen dropped below normal, a detrimental level, we call it, and what your brain did was just to wake you up. Now, the symptom of that shortness of breath is because that oxygen dropped, your brain woke you up, and you took a deep breath. That breath comes with oxygen. The heart and the brain need it most. So your adrenaline naturally kicks your heart to speed up because it is going to be the heart that is going to pump that blood to the part of the body that needs it. So you're laying in the bed, but you're short of breath because your heart is working like a car driving in the city. You stop at one light, the light turns green, you zoom to the 45-mile degree, and then you back down to another red light. Versus if you go to sleep, it's supposed to be a highway, maybe I-95, where you're supposed to cruise and wake up in the morning. There's two people who are sleeping, one driving in the city and the other one driving on I-95. The one driving in the city, that car is going to be burning gas. You're going to be burning your brakes, and you'll get to that same destination with high cost to the one driving in the city. That is comparable to somebody with sleep disorder, like what you're saying. So if you have anxiety, you wake up and your heart is speeding up. So instead of your heart rate going to a resting heart rate for you to wake up, you wake up short of breath. Sometimes you cough and you blame it on maybe the food you ate, but no, it is heartburn because you just took such a deep breath and sucked stomach content up into the upper airway, which is the neck. That stomach content is acidic. It's supposed to stay down and digest food. So natural thing, you drink water, you wash the acid down, you go back to sleep. The same thing happens, you wake up. So your sleep is fragmented. If your sugar is dropping, that is something that we need to look into. If you are on any medication, diabetic medication, that needs to be addressed. But you going to sleep and waking up short of breath is a classic symptom that you do have some sleep disorder that need to be addressed. If you're fortunate and I'll say the ones who get high blood pressure and get diagnosed and somebody send you to a sleep clinic, you are the fortunate one. Some people don't have silent symptoms and they just develop AFib or something and then you take them away.
Oh. Okay, thank you so much.
Yeah, this is kind of scary.
It is.
We all need to get sleep study done. Does insurance cover sleep study?
Yes, insurance does cover sleep study.
Home
sleep study is anywhere between $137 to $327, depending on your insurance. In-lab sleep study can be anywhere $600 to $1,075. I'm sharing my screen. Do you see this?
Mm-hmm.
So this is in-lab sleep study. Do you guys see it?
Mm-hmm.
Okay. And we do sleep study on as young as somebody 4 years. Once the right person catches the right thing, we do the study on them. This is a home sleep test. You take the equipment home, sleep with it, and just bring it back. I mentioned $137. There's something as simple as a ring that you put on your finger. They have an app, and you go to sleep. You get what you pay for, though. The ring will tell us you have sleep apnea, but it may underestimate or even give us false negative results because it's cheaper.
So is it better to have it done at a facility as opposed to have it done at home?
The long answer is yes, but we all know insurance, what the provider wants and what is right for the patient. We always have to fight between insurance So let's say your insurance doesn't require any authorization to approve the sleep study, any sleep study, which some people do. Medicaid, Medicare, sometimes depending on the MCO, they don't get it. You can get it done, right? How much is your deductible? If you've met your deductible and you want to do an in-lab sleep study and $1,000 will not come out of your pocket, you can. Some people say, no, I want to do it in the lab. Then you go do it. And sometimes we have to go around the detour. We know the person has parasomnia or insomnia. The insurance is going to say, no, do a home sleep study. Let's make sure that he doesn't have just sleep disorder breathing that can cause parasomnia first. Once you say the person is sleep talking, sleep walking, and they test positive with a home sleep study for sleep apnea, go treat that before you even go further. So it could be the best option if you look at all these wires is comparing X-rays and MRI, depending on what you're looking for, right? But insurance can determine what you get first, and it doesn't matter. You can start from home and then we end up in the lab, pretty much.
Okay. Wow. So I know part of the reason why we do this podcast is to learn, so we are not ignorant of some of these things that happens to us. So if you're listening to this presentation, listen, we don't need to say anymore. You know yourself. If you need to get tested, please get tested. It's not every sleep disorder that's insomnia. There's a lot of other underlying causes. So don't be a victim, because this is life and death situation. So please, if you need to get tested, please get testing done and follow whatever recommendation given to you by the sleep specialist, the pulmonologist, or whoever is treating you, because this is going to save your life or life of your children or your spouse, your friend. Share this information with other people, because you never know who will benefit from it. If you haven't subscribed to our YouTube channel, please do so. And also, we have this presentation posted on my website, DrEugeniaCaternor.net. You can go back and listen to it again, share with other people so you can also save some lives. Well, thank you all for joining. I know we have gone past our time, but it's a very important topic. And I promise this year we'll have a lot of educational materials. So we are gaining knowledge. As the Bible says, lack of knowledge, my people perish. This year, nobody's going to perish in 2026 because they lack knowledge. We will learn different things. We will talk about different things. If you have anything that you want us to talk about, please text me 443-623-6080. Send me an email, DrEugeniaCaternor@gmail.com. Share ideas with us. We would love to take some of your suggestions and recommendations. Thank you all for joining. Dr. Bernard Addogoh, thank you for your time. I know you are very busy. You and I don't know who is busier, but I know you're busy. But thank you for taking the time to educate us on sleep disorders and the importance of sleep. I know you are saving lives, and we all need to go out there and save lives one at a time. And if there's no more questions, I would say thank you all again for joining. God bless you. And hopefully, we'll see you soon for our next episode of Transformation Talks. Thank you so much for joining, and have a good evening.
Evening. Thank you.
All right. Thank you for having me. You have a good night.
Thank you.
Thank you. Bye-bye.